Hey drivers and certified medical examiners, hopefully this will help both camps out. Today we are talking about some of the diagnostic criteria that doctors may use to determine if a driver needs to be sent for a sleep study for sleep apnea testing during the DOT physical. And this is a topic that has a lot of questions, and I've done a couple of videos on, and there are so many questions surrounding this topic specifically because a lot of drivers are overweight, and that's one of the things we're looking for or can be looking for if we are going to send a driver for a sleep study. And in combination with that, the FMCSA doesn't give us a lot of concrete guidance on what we should be testing for in order to determine if a driver should be sent for a sleep study, like they do with blood pressure and vision and hearing and things like that, where there are very concrete numbers that you must hit in order to pass. All right, so in just a second, I'm going to read through some of the training that I recently just went through as it pertains to sleep apnea and sending drivers for sleep studies. And I just recently retook or got recertified my 10-year certification to continue to do Department of Transportation physicals. It's been 10 years already. Time flies so fast. But this is particular to my training, the training that I did with a private company. The FMCSA requires you to have a private company. There are a number of them that do this education, and you go through the training so you can take the test. And this can be different from doctor to doctor, but I think they did a very good job kind of making it very concise. And they actually made a little flow chart, which I'm going to read. I won't put it up here on screen because it's not my proprietary information, but I'm just going to kind of read through it and give you an idea of what you might be looking for if you're a driver, or what you might be familiar with or maybe unfamiliar with if you are a provider. And this is based on some bulletins and suggestions from the FMCSA. But again, none of this comes from the government specifically. This is something that the training company that I went through uses, so it can vary a little bit. All right, so the first thing that we do is the physical exam, and the first thing during the physical exam is questioning the driver, questioning the patient. This is the health history, and we're going to talk about some of the answers that may come up. So if the driver answers that they get excessively sleepy while driving, or if they have a history of an accident associated with falling asleep, obviously this would be a very bad thing. They're observed sleeping behind the wheel while operating a motor vehicle, obviously not a good thing. They're purposefully not compliant with their sleep apnea treatment, like using a CPAP, and it's intentional, or they have an extremely high risk of having sleep apnea. If any of those is true, then they are not safe to be on the road, in my opinion. I would not qualify anyone that answered yes, or those came up in the particular case that we were looking at. So those are immediately disqualifying. We don't have to go any further. We would complete the exam, but they're not getting a medical card. They're getting referred for evaluation and potentially for treatment. They're not safe if they're falling asleep at the wheel. So if no to all of those, so if all of those questions are negative, then we move on to physical exam, and we're looking then at BMI. If the BMI is under 33, then we move on from screening for sleep apnea, and if everything else goes well, we can certify for up to 2 years. All right, so if the BMI is 33 all the way up to 40, just under 40, then we do further testing to determine what the next steps are, and I will go through those tests here. So we are looking for if your lower jaw is pushed back, so you have what's commonly called an overbite, although it's not exactly the same thing. So we're going to be looking at your jaw position. If you have a class 3 or 4 mallampati score, so we're going to be looking inside of the patient or the driver's mouth. We're looking for males that are 42 or older, or postmenopausal females of any age, untreated hypothyroidism, loud snoring, like you've been observed to be snoring and can be heard like through a wall. Neck size, which a lot of drivers ask me about. Neck size of males over 17 inches or 17 inches or over, or females 15.5 inches or over. Hypertension, arrhythmia, type 2 diabetes, witnessed apnea, or stroke. So if you've got 3 or more of those conditions and your BMI is between 33 up to 40, then you will be given a 3-month certificate and referred for a sleep study. So again, these are suggestions. There may be some variability here between different doctors, but again, this comes from the testing company that I used when I took my recertification. So that is between 33 up to 40. All right, so if your BMI is 40 or greater, then you're automatically given a 3-month certificate no matter what happens with the rest of the exam, as long as you don't fail something else in the rest of the exam, and then you're referred for a sleep study. So 40 or greater is an automatic 3-month certificate and referred for a sleep study. So one of the myths is that you will be disqualified based on your BMI. You won't. You'll be given a 3-month card, but you'll have to go through the sleep study process. You'll have to be tested for sleep apnea. So again, the FMCSA gives the doctors a lot of latitude here. I might refer somebody for a sleep study that doesn't quite fit this. Maybe they don't have exactly 3, but I think it's still unsafe for them to be on the road, or maybe they have more than 3, but based on everything else that I'm seeing, I don't see them to be at risk. So there is some variability and some flexibility with this, but I think overall this is a very good kind of template that providers can use, but take it with a grain of salt if you are a CME, because this again comes from the training company that I went through. Again, another disclaimer. It does not come directly from the FMCSA. Look up the FMCSA standards directly if you want information directly from them. So I hope this helped not only drivers, but also providers. And until next time, everybody, stay safe.